Daily news, breaking news, everyday news on Prince Miller Entertainment TV. Remember, guys, to like, share, comment, and follow. Today is the 26th of August, 2022. And so, guys, Arundel Hospital in the capital is offered to cover the medical bills for the Zimbabwean woman who was recorded while being harassed by a senior health official at Bela Bela Hospital in Limpopo province, South Africa, where she was due for a surgery. In an act which has been widely condemned as unethical and xenophobic, Dr. Poppy Ramatuba, a member of the Executive Council MEC of Health for the province, berated the woman, asking her why she was receiving medical care in South Africa when she was from Zimbabwe. In the widely circulated video, Ramatuba also told the patient, in full view of other patients and hospital staff who were embarrassingly enjoying the scene, that she should seek treatment in her home country because migrants were stretching her department's budget. Touched by her plight, Arundel Hospital, which has an ongoing philanthropic practice where it provides free medical assistance to individuals from all walks of life, reached out to social media for assistance to identify the woman so it could settle her bills. Arundel Hospital will settle all outstanding bills for this woman. The hospital tweeted, "We take pride in our efforts in collaboration with the government of Zimbabwe to provide optimum health care for all." Meanwhile, pressure continued to mount on Ramatuba, who the South African Opposition Party, the Economic Freedom Fighters EFF, described as a reckless populist whose conduct was cynical, arrogant, and moral bankrupt. And the South African Opposition Party, the Democratic Alliance, has since taken Ramatuba's actions before the country's Human Rights Commission. DA Limpopo health spokesperson Risham Maharaj said Ramatuba's comments were xenophobic and could spark tensions against foreigners. Irresponsible utterances might even stoke xenophobic attacks from locals who believe foreign nationals are responsible for the poor healthcare services in Limpopo. Reacting to the video, the South African Department of Health said while foreigners were indeed coming to South Africa for medical attention, the healthcare workers should ensure that they maintained high moral obligation and standards in their work in line with the Hippocratic Oath, together with the National Health Act and the Refugee Act of South Africa. This does not mean that all services are free, because only primary health care services are provided free of charge, but higher levels of care are subject to a fee. The South African Medical Association was more damning in its assessment of the situation. It said it deplored the manner Ramatuba addressed her misgivings to a patient, and that her attack was also contrary to the central principle of the United Nations 2030 Agenda for Sustainable Development, which seeks to ensure that no one was left behind. The MEC, as a leader in the province, is aware of the appropriate channels where such matters ought to be raised. Additionally, the MEC has a duty and responsibility to comply with the ethical conduct befitting a healthcare professional who took an oath which clearly states, "First, do not harm." The Health Professions Council of South Africa's ethical guidelines and the SAMA pledge summarize all doctors to a duty of care, respecting the dignity of the patient and fostering the noble traditions of the medical profession without prejudice, which in this instance appear to have been contravened. It said, SAMA believes that healthcare is a fundamental human right. Foreign nationals such as refugees and migrants are one of the most vulnerable members of society. When people are marginalized or face stigma or discrimination, their physical and mental health suffers. Discrimination of any kind in the healthcare sector is unacceptable and is a major barrier to global socio-economic development. SAMA said the rights of migrants to medical care were guaranteed by Section 27 of the South African Constitution, which states that no one may be refused emergency medical treatment. SAMA notes that Canada, mentioned in the video by the AMC, has interim federal health policy program for different levels of foreign nationals that is available temporarily and or as a last resort. In the US, under the Healthy Environment for All (HEAL) Act, the country would allow undocumented immigrants access to health care through formalized payment contributions and to be eligible for subsidies to offset the cost of this coverage, it said. So guys, that's the latest here. Arundel Hospital. Yes, it really wants to pay for that lady who was humiliated in that video which circulated on social media a few days ago. And I would wish Arundel hospital would also pay for other Zimbabweans who are in many hospitals in South Africa. Yes, discharged. There are so many, and that woman is one of many women, many men, many people who are stranded in hospitals. So I heard that Kula Tagwire is the owner of that Arundel Hospital. Yakati kwanza kubhadharira mukadzi uyu ainzoni abude kana asina kubhadhara mari yaidiwa. And so this is daily news, breaking news, everyday news on Prince Miller Entertainment TV. Guys, do like, share, comment, and follow, and turn on the notification bell so that you won't miss any of our new uploads that we do upload here. And so quite sure to my clinics, my public hospitals in Zimbabwe, they need a very serious attention. Anyway, it's a topic for another day, but I still feel that there's too much that the government needs to do when it comes to the health sector, because I saw a video on SABC whereby women, pregnant women, are actually coming from Zimbabwe to South Africa just to give birth in South Africa, because vari kutya kuti kana vakaoperatwa kana kuti vasei kuZimbabwe hazvimire musho anotofa. And saka motomeremi kutoti vazhinji vakawanda vakutocrossa from Zimbabwe vachiuya South Africa just to receive medical attention. Saka zvinomira musho, and most of these people vanenge vasitorina kana madocuments anenge vanawo. And saka inyaya itori very serious, which by South Africa, you could tell you guys Mawandis, you guys, you're now taking advantage of this free healthcare here in South Africa. And I do understand where the lady was coming from, although the whole discussion was at the wrong place at the wrong time with the wrong person. And they need to face the current government when I discuss more about this, because mukadzi uyu haana mhosva munhu wekutoti akatosvika hospital achida kubatsirwa aitodawo help, not kuudzwa zvokuti hanzi mapercentage or budget or whatsoever. Aiwa aitodawo help. And so the MEC, what she said is true, but she said it to the wrong person at the wrong time at the wrong place. This is daily news, breaking news, everyday news on Prince Miller Entertainment TV. Remember guys, to like, share, comment, and follow. Bless up.